Good morning, everyone. So I'm going to kick off this first hour with a series of mini sessions. If you're like me and you come to conferences, it is so tempting to be looking at my email within 5 minutes. So this is like rapid fire, very fruitful information that you can take back after today. This session is called No Money Left Behind, a success story and strategy to offer chronic care management services. About me, I am Larry Rector. I serve as the CEO, COO, CFO at Dayspring Health. I promise I am not power hungry, and if any of you would like one of these hats, come see me after this session. Dayspring Health is a community health center in southeast Kentucky. We serve about 10,000 patients. And for many of you throughout Kentucky, you can appreciate 10,000 patients can be a lot. We serve about 35% of the people in our service area. In addition to that, I do also work at River Valley Health, used to be called Cherokee Health Systems. I serve as the VP of Finance there. And because sleep is just overrated, I also do consulting on the side for finance and operations. But like you, like at the end of the day, like all of us in this room, we are tasked to evaluate and create solutions to problems for the sake of taking care of our community and for the sake of sustaining the mission of the organizations we're at. So, good to see you. We're going to start off with some problem statements. I want to see if we are together in this. Do you resonate with, I struggle to recruit and retain great team members? Seeing some heads nod. Yes, that is not a new thing. But this solution is to also kind of mitigate that problem. The ever-changing healthcare landscape worries me over the sustainability of our clinic or hospital or operation. I just had a conversation this morning. I was like, is it true this extension of telehealth has not been approved yet? Like we're days away from that? Yes, that is one example of our ever-changing landscape. This idea to present this was actually spurred by what's coming with Medicaid changes. Like a lot of conversations that I'm having with other leaders is, okay, if the number of Medicaid patients is going to decrease, how do we ensure that the bottom line is protected for the long term? Like just two examples. If our team doesn't do it, it's never done well. This idea that if we don't do it with our team, we can count on it not working. I can resonate with that sometimes, and sometimes it's like, wow, actually I'm so grateful for the external partners that we bring to the table to help us take care of our patients. Our patients' needs and outcomes must improve. Like at the end of the day, this is the work that we're doing. If we look at our mission, this is at the forefront of that. So this is probably always on your mind of how do we do this better? And then lastly, rest doesn't fill my tank like it used to. This session will not solve this problem, but just to say, these ongoing struggles, you're not alone. We are in a community together. Rob, you had mentioned, like we are all leveraging the resources that we have to take care of the patients in our midst. So, in response to that, I love this quote from Peter Drucker: "The greatest danger in times of turbulence is not turbulence itself, but to act with yesterday's logic." This idea that we work in healthcare is not new for us to say things are changing. And trying to figure out how do we solve tomorrow's problems cannot rely on the solutions of today and yesterday. I mean, this idea that we're having this conversation about telehealth, if you had had this conversation 10, 20 years ago, that looks very different, right? But then to think about the strategies that we have today, those cannot be what we rest on for tomorrow's problems. So, zooming in or pulling out the binoculars, the idea of this was no money left behind. But the big picture of that was leveraging telehealth for enhanced care and additional revenue stream. So, chronic care management, CCM visits, is the highlight of this. Just curious, by show of hands, who's doing this already? Okay, very good. So This is a service that came to my attention back in 2019. It wasn't new necessarily then, but it was this idea of how do we take care of patients with 2 or more chronic conditions that are Medicare enrollees. For those that have been doing chronic care management, you may be familiar with the code G5011. For the billing folks in the room, they're like, I love CPT codes. That's like, I go to sleep and read books about that. The new thing here is the idea that this code has been replaced with 99490, and there is a new code, 99439. CCM was this one encounter per month model, and now you can do more than one. Zooming in a little bit more. Okay, so this slide is actually using content from a vendor that I'll highlight a little bit later in my story. But it's to highlight the 2 visits that now exist. This first 20-minute call per month for patients with 2 or more chronic conditions. You know, doing chart review, chronic condition education, document the EMR, coordination with the practice, but essentially they're checking in with the patient to ensure that they're on the course to better take care of their health care. Then CMS has come out with, wow, we're actually seeing really great results with this program. Let's allow you, in other cases, to have more than one call. So this just is a list of things that can be covered in the subsequent calls, again, to better help the patients. So experience at Dayspring Health. Back in 2019, we were having a conversation of how do we better take care of our patients and then boost the bottom line. Kind of a conversation I'm sure many of you have had multiple times. And as the COO and CFO at the time, the team said to me, can we do this? I said, we should do this. Yes, we should do this. But we don't have enough bandwidth from our nursing team, because these visits can be done by nurses, to do this. Like I mentioned in the problem statements, we are having a hard time finding and retaining great nursing staff along with everybody else on the team. So then it was a conversation of, well, could we outsource this? Could this be a service that's done well and not be done by our team? We did reach out to a recommended vendor back in 2019. I won't share their name because we didn't end up staying with them because within 18 months that we terminated the contract. We had a lot of bad feedback from patients. They would enroll in the program and then quickly unenroll in the program. And I thought, okay, that was not worth it. I'm not going down that road again. But back then, we reached out to what I would consider a sister clinic, Cherokee Health Systems. We collaborate with them all the time. And they said, why don't you consider using the vendor that we use? And they're called Chronic Care Staffing. When the RFP for this session was approved, I was like, okay, I need to reach out to my friends at Chronic Care Staffing and say, come to this conference. So they're in the back. So and to give some context, if you're not familiar with Cherokee, now River Valley Health, they serve about 70 to 80,000 patients in the Knoxville area. So much bigger operation than Dayspring, and they've been using them for a long time. I have been so impressed with the work that Chronic Care Staffing has done for us. For example, patient impact. When you just look at year-over-year data, our A1C scores for those patients enrolled in the program in 1 year went from 9.9 overall average to 8.73, just in 1 year. Then when you kind of zoom in some more, 72% of the population had a decrease in their A1Cs. 56% of them dropped below 9. 44% of them dropped below 8. So this is real patient outcomes that are making a difference. Also, hypertension patients that are enrolled in this program saw a significant improvement in their heart rate, heart pressure. Operational impact, I did not have to utilize my nursing team to do it. We knew that this was a needed service, but we didn't have the bandwidth. Also, the patients that are enrolled in this program, when I reach out to them, they would assume that these folks that are calling them are at Dayspring, because it's not just John Doe of the month calling them. These are people that actually establish a relationship with, that they feel like they're listened to and heard and are taking their advice. And then the financial impact, it is a boost to the bottom line. I mentioned that Dayspring Health has about 10,000 patients. So then when we're talking about patients with 2 or more chronic conditions that are on Medicare, whether that's traditional or Medicare Advantage, the population is pretty small at that point. We serve about 400 to 500 patients in this program. It adds about $150,000 to $200,000 to the bottom line per year, so significant. Missional impact is the idea that our mission, probably mirrors a lot of yours, is to ensure access to high quality healthcare, and that cost is not a barrier. But at the end of the day, that our community is better cared for and we are protecting the mission for the long term. This has been such a success story for us over the last so many years. Here's another chart to kind of highlight what you can charge for these services. In this chart also is RPM, which I'm not highlighting in this presentation, but to give you that information. So that first call is that 99490. They reimburse about $60 for that, but then those subsequent calls are about $46. So potentially up to $150 per patient per month, just on that. So bottom line, improved patient care. This isn't just a way to add money to the organization. It actually does have improved results for your patients. Our most vulnerable 2 or more chronic condition folks that are in our midst are being checked in with on a regular basis and encouraged to take their meds and take care of themselves, and are an extension of the work that we do in our clinics. Better utilization of limited quality staff. So if you're in the boat like me of outsourcing to do this, you can do it in-house. You can use your team to do this, but if you don't have that capacity, then you can utilize, say, an outside vendor and still get these outcomes. And then lastly, it's an enhanced net income to invest in other missional activities. What's on the horizon, in terms of what's reimbursed. If you, when I think about, I mentioned Medicaid patients decreasing, but those of you that are in the room that might rely on 340B resources, like that could be its own session. There's a lot of volatility. So finding ways that you can kind of offset those potential losses and have improved patient outcomes is such a win. So this is just to say, feel free to reach out to me. I'll put my cell phone number on there. There's also my Gmail account, or if you're on LinkedIn, would love to connect with you. Thank you so much.